Welcome to Medical Dialogues. I'm Dr. David DeRose with Dr. Greg Steinke. We're speaking about things that can help your immune system, help you fend off or prevent COVID-19, at least more serious infection. One of the things we talked about in a previous episode was how overweight can be a particular challenge. Dr. Steinke, that may sound like bad news to people, but there really is good news on this topic. Tell us about it.
One of the things that we have learned is that the excess weight is a significant risk factor for developing severe COVID-19 infections. What we want to do is immediately start working on reducing our weight. The reason that this happens is the restrictive pattern that you see in the lung when you gain weight begins to make it more likely that you'll get sick in your lungs with the COVID-19 infection. You want to immediately start a walking program. You want to immediately cut out the foods that you know you shouldn't be eating. The crinkly bags, the high-fat foods, the high-sugar foods, all the extra snacks, trying to cut back on the volume of food if it's in excess, and really start working on reducing your weight. I had one patient who came in who was quite overweight. And about a month before he got the infection, he had really started working on weight loss. He lost about 10 pounds in that month, and he was very sick for a long time. He was on the ventilator for about a month. And I got to get to know him while he was recovering on the ward again. And you know what I came to believe as I was talking to him? That if he had not lost that 10 pounds, he may have very well lost his life.
Really? So this was a COVID-19 patient who had been losing weight prior to actually contracting the disease?
That's right. He had been working on it. He knew that he was in some trouble. He knew that things were not going well with his health. He was not feeling well. And so he started making some moves. He started exercising, he started living healthier, he started cutting back on some things he knew he shouldn't be doing food-wise. And I think it saved his life. I think if he had stayed in the previous condition, even though it was only about 10 pounds of loss and he needed to lose much more, I think that if he had been in that situation, just because of the fact he barely eked by, he barely saved, his life was barely saved. He was on a ventilator over 2 weeks. He was very, very ill.
One of the things you mentioned, this restrictive lung problem. I mean, is part of it just the simple physics of if you got more weight all over your body, you have to move more when you breathe? Is it that simple, or is it more complicated than that?
That's absolutely right, Dr. DeRose. The increased weight on your chest absolutely increases the pressure on the lungs in terms of just the weight of it. And that restricts the movement of the lungs. The excess weight in the belly restricts the movement of the lungs especially. And so as you start losing that weight, the lungs actually are fixed. Studies show that weight loss fixes that problem.
Now, what's exciting to me, Dr. Steinke, is the kind of things you're talking about as far as weight loss are other things that I'm seeing other researchers and other experts saying would help the immune system in and of themselves. So even the person who says, hey, I've been trying to lose weight for the last month, the pounds are not coming off, but if they're getting away from those sugary foods, if they're moving more, getting more activity, don't these things have natural benefits for immunity?
Absolutely. For example, you can look at the mineral zinc. We know that people who have low zinc intakes have more upper respiratory infections. So the zinc-rich foods that I'm thinking of are beans, pumpkin seeds, cashews, chickpeas, oatmeal, whole wheat bread, dry almonds, kidney beans, Brazil nuts. So you're looking at beans, you're looking at whole grains, and you're looking at nuts and seeds where you can get zinc. And when you eat more of that, you lower your risk of upper respiratory infections.
So this is great stuff. I know we've got a lot more to talk about in subsequent episodes of Medical Dialogues. We want to give people practical things they can do in small, bite-sized increments without having them overeat, whether it's on medical information or on anything else. I'm Dr. David DeRose. We'll be back with more in a subsequent episode of Medical Dialogues. Hopefully this has helped you grab some encouragement to keep moving forward.